Hi everyone, my name's Dr. Lauren. I'm a veterinarian of 15 years experience. I currently own and operate a mobile veterinary service. Many of my clients report that they had no idea a mobile vet was even a possibility and have gone potentially years without veterinary treatment purely because they've been unable to get their pets to a vet, and that's really difficult for them. Oftentimes they've ended up turning to the internet for veterinary advice, which is usually not a great idea. There's a lot of misinformation out there, some of it downright dangerous. So I suppose the purpose of this channel is to try to debunk some of the myths that's out there, because I can't solve the mobile vet shortage that's out there, and I can't solve the problem of people not being able to get to their pets to the vet. So hopefully this can be a source of information for people that can provide at least a little bit of information that might just help people to look after their pets at home when they have no other choice. However, I'm jumping the gun a little bit. We will get into some of those informative videos down the road, but today I wanted to talk about an experience that I had recently, and two, a report that's been recently released on the topic. So a few weeks ago I received a phone call from a client of mine. His dog has itchy skin, which we've treated in the past. This dog has a condition called atopy. It's essentially allergies, and it just requires some ongoing management with some medication each day. He wasn't having any trouble administering the medication, and the medication was working really well. However, he just decided that he'd had enough and didn't want to do it anymore, and asked me to euthanize his dog. I tried to talk to him about what struggles he was having, or what barriers to treating the dog he might have been having. I tried to offer some cheaper alternatives to the medication. However, he really wasn't interested in chatting about that, and I understand he was probably under a fair amount of stress in making that call, and I understood that. I was as gentle as I could possibly be with this man who was obviously having a hard time. The conversation, however, took a bit of a turn. Eventually I ended up having to say that I really wasn't comfortable with euthanizing an otherwise healthy dog. I knew that someone else would be able to take care of this animal and look after this animal and treat it, and that things would be just fine if that were the case. He really wasn't interested in doing any of that, and proceeded to kind of say, well, are you going to do it or not? To which I had to bluntly say no. He then said, well, I'm asking you to do it, so you have to. And I said, I'm sorry, I'm not comfortable. I referred him to another veterinary service for him to have a second opinion on the matter. And then he pretty point blankly said, well, if you don't do it, I'm going to do it myself. And then he hung up the phone on me. And you know, that those calls are really tough for us vets to have to field. We're not trained in dealing with people like this. We're not counsellors, and we really just have to do our best with the bad situation we're presented with. But that on its own isn't the biggest issue that we face. I think there are so many reasons why us vets struggle with mental health. The report that's come out recently has stated that, you know, more than 70% of vets know another vet that's committed suicide. The rate of suicide in our profession is 4 times that of any other profession. 88% of vets are considering leaving the profession within 5 years after all of that hard work to get where they are. A lot of us are doing ridiculous hours, a lot of it unpaid. We're working on call overnights. We're expected to be back at work 9 a.m. the next day. We're making less on average than the average wage in Australia, which to me is crazy considering how much work and study and money, $85,000 in South Australia for a veterinary degree now, that we've had to go through to get there, just to get there and end up hating it and wanting to leave, which only puts more pressure on the rest of the vets that are in the industry that have to try and fill the void of experienced vets. There's no shortage of new vets coming in. There are plenty of us that have brains in our heads that care deeply about animals and their welfare, and care about helping people help their pets. And I suppose the point of this video is to try and get across that we're not out there to try and just line our pockets with your hard-earned money. When we give you a big bill, it's because that's what it truly costs to treat your animal in the best way possible. We're not trying to send you broke. We're trying to help your animal. We don't have any subsidies coming back to us from the government like they do in the Medicare, in the medical profession. And I suppose the alarming part of this report that's come out is that they've stated that the verbal abuse coming from clients, and a lot of it's financially driven, but there are many different things that are causing that to happen, is actually on the rise. And that's really surprising to me, because there's so much education and information out there from the medical sector on how it's just not okay to treat your medical professionals with disrespect and abuse. And I really would have thought that things were getting better with time. I had hoped that they would be getting better with time, but it just doesn't seem to be the case. So point being, I hope that everyone out there, the next time you're in a really stressful situation with your pet, and rightly so, you can be frustrated, you can vent your grievances. We've heard it all before, and we will be there for you. We will be the shoulder to cry on. We will counsel you, even though we're not counsellors. But try to keep in the back of your mind when you're feeling frustrated and angry at the world for the situation that you're in, that the vet's there to try to help you. We're not the enemy, and to take those frustrations out on your vet and make them feel just absolutely awful is really hard on us. And I hope that everybody can remember that, because it's likely that you're not the first person to have brought that to us. We may have gotten off the phone and had that conversation I described earlier, not 5 minutes before you walked in the door, and we entered the room with a smile on our face and brought our best self forward despite all the feelings we had about that call that we had to push right down. And when that happens one after the other, and we have to bury 5 things down in a day, it's just so taxing on us. And I really hope that things do improve, because the way this industry is going, we're just not going to have any experienced vets left, and it's going to be really hard on emergency services. There's going to be longer waits. Triage will get really stringent, and I hate to think of what will happen in animal welfare terms if things keep going the way that they are. For anyone out there that needs support, I know that we talk a lot about resilience in our industry, and while there is certainly a place for that conversation, there is absolutely no shame in feeling your feelings in an appropriate context, of course, and asking for support from your colleagues, and reaching out for professional help if you need it, because this job can be really hard, and we have to accept that it can be really hard and not just try and toughen up. I don't think that's the right angle, and I hope that the attitudes will change. For any of you that feel that you'd like to support this cause moving forward, there is a website that I'll link below called Sophie's Legacy. It's run by Sophie's parents. Sophie is a vet that a number of years ago sadly took her own life, and a lot of the contributing factors for that are believed to be some of the things that I've discussed today. So the link's below. There's a petition that's online that you can sign that will hopefully advocate for some changes that are being currently proposed to the South Australian government. And once a precedent's set there, my hope is that that will carry through to the rest of the states in this country, and that change will be coming, and that improvements will be made, and the vets will be better supported into the future. Thanks for listening.